people. The mask protects other people, not me. Don't you care about the well-being of others? You've probably heard these pro-mask statements for months now, and no matter how inconsistent the rules become, mask shaming is the newest way to show how compliant you are. I follow the rules, don't you? And like tattletales at school, people do it to feel good. Their social media and public officials tell them it's a good idea. Maybe it makes sense if you actually think others are committing murder and you're preventing it, you might be right to feel good about it. That's what New York Governor Andrew Cuomo told people back in May.
You could literally kill someone because you didn't want to wear a mask. I mean, how cruel and irresponsible would that be?
Of course, Cuomo had no idea if that was true. The WHO, CDC, and Dr. Fauci have all flip-flopped on the effectiveness of masks. No one can show how effective they really are. They do not block viruses, especially not cloth masks. It's just assumed. Droplet containment will stop the spread. So obviously Cuomo didn't base this policy off of science and logic, we know that, based on his patient relocation policy, but we haven't heard him admit it before. In newly leaked audio, the governor admits that the coronavirus response he implemented has not been nuanced nor sophisticated. Listen.
This is not a highly nuanced, sophisticated response. This is a fear-driven response. You know, this is not a policy being written by a scalpel. This is a policy being cut by a hatchet. It's just a very blunt. I didn't propose this, you know. It was proposed by the mayor.
What can I do? I'm just the governor. New York State had some of the worst rules and decisions. Police visiting out-of-towners to make sure they're quarantining. How could that go wrong? And in the spirit of that, even the WHO has been forced to state that lockdowns are not sustainable. It was never proven that they were. Again, there were panic-driven rules put in place, but they didn't seek any consultation from regular citizens.
We in the World Health Organization do not advocate lockdowns as a primary means of control of this virus. The only time we believe a lockdown is justified is to buy you time to reorganize, regroup, rebalance your resources, protect your health workers who are exhausted. But by and large, we'd rather not do it.
If you ask some politicians, like, I don't know, let's say Doug Ford, if the lockdowns and mask mandates aren't working, enforce more lockdowns and more mask mandates. But you can't blame him. He has a great team of doctors no one is allowed to see or hear from. He consults with them privately. Now, the WHO, who may be right, they may be wrong. They obviously can't be trusted, however. But that doesn't mean we should act swiftly and without thinking now. We can't trust them to be consistent on China, on masks, on lockdowns. But herd immunity, the WHO says, that is unethical and dangerous. The world's greatest health organization has changed their opinion for a second time because people are only allowed to disagree with them once they are consistently proven wrong on a topic, which keeps happening.
Allowing a dangerous virus that we don't fully understand to run free is simply unethical.
Says non-Dr. Tedros. So lockdown's bad, but letting everybody be free, also bad. I think we understand now. I'm sure it won't be long before they change their opinion on that as well, because there are studies coming out that are to the contrary. Despite their condemnation of Sweden also, who barely did anything for coronavirus, their death rate has plummeted. And so have many other places though, which further supports the hypothesis. After a reassessment, the British Medical Journal essentially said that their lockdown and social distancing strategy was completely wrong, saying, quote, school closures and isolation of younger people would increase the total number of deaths, albeit postponed to a second and subsequent waves. The findings of this study suggest that prompt interventions were shown to be highly effective at reducing peak demand for ICU beds, but also prolong the epidemic, in some cases resulting in more deaths long term. This happens because COVID-19 related mortality is highly skewed towards older age groups. And lastly, the optimal strategy for saving lives in a COVID-19 epidemic is different from that anticipated for a flu epidemic, which of course is what they did. Now, we started the segment about masks and how good they make you feel, but perhaps predictably, that conspiracy might also be coming true. According to a CDC study that many are now just seeing for the first time, data from 11 outpatient facilities are reporting that 71% of coronavirus patients said they always wear a mask and 14% said they wear a mask often. That's 85% of people who wear a mask often or all the time, yet they still got sick. How does that work, you tell me? Of course, many people knew the masks don't really do anything. No one could prove that they do. You could smoke a cigarette through one, for example. And there's obviously a reason the military wears gas masks and not paper masks to stop viruses. Now that we can see that government mandates are at best questionable, they're inflating numbers and basing policy off of guesswork continuously, they've put themselves in a position where everything they say must now be questioned. And we should start with the medical bodies and politicians who are taking cues from them. If you'd like to find out what the mask laws are in your area or you want to get a mask exemption button, go to maskexemption.ca now.